I wasn't expecting company. Welcome to Horizon Therapy, where here we develop psychoeducational therapy films for upcoming therapists that are training to deal with sexual issues. Today we'll be working on sexual pain disorders. Today we're going to show you the assessment process, the questions that need to be asked to a couple or an individual, and then a treatment process. Now, due to time limitations, we can only show you just a limited portion of the things to come, but please talk to your teacher to ask you for more information. Today we'll be dealing with Clara. She's a 33-year-old woman who has been having severe vaginismus. And vaginismus is simply the tightening of the pubic muscle, and we will be working on that with her husband Tom. And so stay tuned and enjoy us at Horizon Therapy.
So I know that you guys were referred by Dr. Goff, your gynecologist, to come in here and see me today, but I just wanted to start off by getting to know a little bit from your perspective about kind of what brings you in.
My doctor couldn't examine.
Severe pain and she couldn't examine you. It's kind of been a problem, this pain. Is this something that's new?
No, it's for maybe 8 years.
Yeah, I mean, since we've been married for 8 years, I mean, it's always been there. So. For our whole first year, we couldn't do anything. There's no sex at all for our whole first year of marriage. It took a really long time for that to be able to happen.
Okay. So right from the beginning, really, some struggles with that?
Yes.
And then maybe a period in there where it was a little bit more possible, but kind of, it sounds like you've moved back to a time where it's not happening at all?
Yeah.
Is that correct?
Yeah, pretty much.
Okay. Okay. So I know you're the one that's experiencing this pain. I'm curious, kind of, are you able to insert anything into your vagina, like a pinky finger, a tampon?
I can put my finger.
Okay.
It's too painful for me, so.
Okay. So no types.
No finger or no tampon, so I cannot.
So I understand from the intake packet that you have not experienced any sexual trauma, abuse, or rape. Is that correct?
Yes.
That's correct. Okay. And what about for you?
No, nothing.
Okay.
Nothing like that.
Okay. Well, I just wanted to make sure. I know at some point in time, you were able to have intercourse. A penis was able to be inserted, correct? At least some point in your marriage.
The therapy that we had before helped a lot. I think it was just because we felt a little bit closer, so that helped. But overall, it's been pretty consistent. Nothing works, or it's still painful, but it's doable, I guess.
Okay, but it hasn't really been consistent.
Well, it has been consistent in the fact that
It doesn't work.
yeah,
Okay.
it doesn't really work.
Okay, so you mentioned that the marital therapy was helpful, and that you did feel closer to one another. In what ways, I guess more specifically, did you feel like that was helpful for you guys?
Well, I feel like at least, we got to talk more openly about some of our conflict, so that helped. We got to share some more issues that we didn't really feel comfortable talking to each other about. I guess we never, talk about sex. Very rarely, Clara didn't experience that in her childhood at all, or talk about sex growing up. So just talking about it was hard, and having the therapist help us do that a little bit, that was kind of different for us.
Yeah.
I felt kind of embarrassed to talk about sex
Okay.
with someone, but I think when going to therapy kind of made me realize it's okay to talk about sex with someone.
Okay. So it sounds like what was really helpful for you guys was learning to communicate a little bit more openly about sex, and that maybe helped to contribute to some, maybe be able to engage in some more, in intercourse more often than you had. So it sounds like since then, though, things have gotten kind of back to the way they were at the beginning of your relationship, where you can't even insert a pinky finger now. So kind of tell me about how you think you've gotten from that point to where you currently are.
And then, I mean, during that, I guess, that's when Claire got pregnant, and we had our baby. But I guess during that time, there's a lot of lots of things going wrong with the pregnancy and afterwards. I had a premature baby.
Okay.
So I just feel so guilty about that. So I don't wanna, have another premature baby.
Okay.
So that's awful to me.
So it kind of makes you anxious, thinking about maybe getting pregnant again because you don't have another baby that's premature, born prematurely.
Yeah, I think one of our big kind of shadows over us, I feel like, is Claire has a condition, endometriosis, and we both kind of feel like that played a big part in why our baby was born premature.
Okay.
So it's kind of difficult for us to talk about and to think about having another baby, though we both really want one, and I think I kind of, more than her, sometimes want another one, and it's just kind of this fear that something bad will happen again.
Yeah. Yeah. So it seems like that was a pretty, major life event for you guys as a couple to experience, and kind of in that time from after marital therapy to now, that's something big that has really kind of happened in your guys' life.
Yeah, definitely.
Yeah. Yeah, I can see that. It's really an emotional thing for both of you guys. So has there ever been a time when intercourse or penetration wasn't as difficult as it is today? Maybe an exception? Yes. Okay. So when did that happen?
Maybe after we went to therapy.
Okay.
I had some pain still, but it was not bad. So
Okay. Yeah. So if you were to rank that pain on a scale of 1 to 10, how would you rank that? How painful it was?
maybe 3 or 4.
Okay. Okay. Now tell me about currently, when you think about penetration, or any type of penetration takes place, what's the pain level currently?
Maybe 11.
Curious about back at that time, that exception when it was more bearable. Tell me about how anxious you got thinking about intercourse or penetration on a scale of 1 to 10.
Maybe 9 or maybe 10.
Okay, so pretty anxious
Yes.
in that experience.
Yeah, it took a while to calm her down, I guess, and the therapist kind of walked us through some techniques to relax a little bit or something, even not even during sex. It was more stress kind of stuff, but so we were able to go through those exercises, and I think that helped kind of relax her.
Okay, to bring the anxiety down.
Yeah, I think that helped.
So right before intercourse took place, after you maybe done those relaxation exercises, how would you have ranked that anxiety? And maybe I'll ask you, since you probably experienced it.
Well, I mean, if from before then was like a 9, then after I'd say it's lower. Like maybe like a 4.
Okay.
Maybe, so she was a little bit more willing to try things.
Okay, so Clara did appear less anxious to you about penetration after those relaxation exercises
Yeah,
that you learned.
yeah.
Okay. And currently, tell me about your anxiety now when thinking about penetration. If you start thinking about, maybe there's going to be intercourse, how anxious do you get on a scale of 1 to 10?
10.
Okay. So high anxiety, just thinking about it. Typically the second part of this kind of assessment that we do it's called a sexual genogram.